I'm pleased to report today that 7,191 Albertans have now recovered from COVID-19. We've conducted more than 6,300 new tests and have identified 26 more cases in the province that happened yesterday. Currently, 38 people are hospitalized with COVID-19, including 8 who are currently in the ICU. I must report 1 new death in Alberta, bringing our total lives lost to 154. This death is linked to the outbreak in a unit at the Misericordia Community Hospital. 6 patients and 5 staff have now tested positive for COVID-19. My colleagues have assured me that outbreak measures are in place and aggressive testing is underway. All patients on the affected units and staff who have either worked on or been present on those units are being tested even if they do not have symptoms. This is yet another reminder that COVID-19 can be a very serious illness. My condolences go out to all those who are grieving this new death. At the Verve condominiums, there are 32 cases, 27 of which are active and 5 of which have recovered. It's really important. It sounds like you've perhaps been in touch with someone at that building and you're mentioning the name. I want to emphasize and underscore the importance of not stigmatizing any particular location or group of people because it's really critical that whoever has come forward and been tested and participated with public health follow-up does not suffer negative consequences, as that will unfortunately potentially deter others from going forward and being tested. What has been done for this particular building is public health at that local level is working very closely with building management. They're making sure that there's enhanced cleaning. They've offered testing to everyone in that building, whether or not they have symptoms. And so I think the question of whether or not we're likely to see additional cases, it's possible, but I do believe, again, that every measure that needs to be taken to prevent spread is being undertaken. And as I mentioned, when I previously mentioned this particular outbreak, at the moment it does seem that possibly high-touch surfaces are a mechanism that's still being explored. But again, all of the measures that need to be put in place to prevent transmission are being put in place, and Alberta Health Services is working with that group of people and getting a lot of support from that local management group. Our statistics that we had done up a couple of days ago indicated that 77% of the deaths we've had in Alberta have been in continuing care settings. It is a very high risk setting for individuals who live there, both with respect to spread of the virus in that communal setting, as well as high risk for severe outcomes for those who are older and have medical conditions and live in those settings. So that's why we've taken a number of the measures that have been put in place with respect to having staff working only at one long-term care or designated supportive living facility and not being able to move between them. Also making sure that there's rigorous screening of staff members when they enter for symptoms or COVID exposures, that residents have daily symptom screens so that if there is a case of COVID, that it can be detected as soon as possible. And we have had very rigorous visitor restriction policies in place for many months now. We have been doing a series of town halls this week to hear from residents, operators, and family and friends of those who live in continuing care to understand what measures we might be able to ease slightly with respect to the visitor restrictions while still keeping residents as safe as possible, because we know that while what we've learned from our experiences is that introduction of COVID-19 into one of these facilities can spread extremely fast and have tragic and devastating consequences, we also know that the very strict restrictions that are in place right now for all those who live in these settings is having other kinds of health impacts. And so with respect to a second wave, I would say we can't relax our guard even tomorrow. A second wave could happen as soon as all of us start to ignore the public health restrictions. Second wave is not guaranteed to happen only in the fall. So we need to keep our guard up in all parts of our lives, not just in continuing care. So I think with respect to preparing for a second wave, essentially what we're doing is keeping the restrictions in place that are the most effective means of protecting residents while looking at ways to improve quality of life through some measures that we might be able to ease off slightly with respect to visitor restrictions.
Since day one, testing has been a cornerstone of our pandemic response. And it's one of the many aspects of our response where we've been a leader in Canada and the world. We've performed more than 415,000 tests to date, and that number continues to climb every day. Our testing approach is a model for the rest of Canada, but we continue expanding. We continue improving our provincial capacity. And Albertans expect us to do everything possible to protect them from COVID-19, and we're doing exactly that. That's why I'm pleased to announce that people with no symptoms will soon be able to get tested in community pharmacies, making it easier for Albertans to access testing so we can continue to slow the spread of COVID-19 throughout our province. In the coming days, a number of community pharmacies with the skills and capacity will offer testing to Albertans without symptoms and no known exposure to COVID-19. This is in addition to the robust COVID-19 testing that's already offered province-wide by Alberta Health Services. The pharmacy test is a throat swab, which will be sent then to Alberta Precision Labs for analysis. Now, to ensure safety, participating pharmacies will receive specialized training and they will follow strict safety protocols. Over the next few days, 20 pharmacies will begin to offer this testing, mostly in Edmonton and Calgary. This will help us to ensure here in Alberta that testing materials, data, and supports are working well before expanding this initiative further. And so we'll add more pharmacies in the coming weeks, and I encourage anyone without symptoms to call their local pharmacy in the coming weeks to see if testing will be available there.